Over the last 2 years, almost 3,000 British Columbians have died, and we've seen a tremendous growth in organized crime because of the profitability of fentanyl. As you've seen, recent investigations have concluded that about $5 billion per year is being laundered in the Lower Mainland real estate market, and I can say with a lot of confidence that is just the tip of the iceberg. The fentanyl epidemic is a natural consequence of heroin prohibition. So the vision is that there would be a healthcare provider to ensure that this is an individual with opioid addiction. You know, you're coming out of town to Vancouver to see the Canucks game and you've heard you can buy heroin and you know you're not a heroin user, you're not going to be able to buy heroin. But for an individual with opioid addiction would get assessed by a healthcare provider to be a member, and then they'd be able to go and purchase heroin. They could use it on site ideally.
I love being a family doctor and I'm passionate about primary care. And one of the things I've learned over the years is that when you have a harm reduction program and you put primary care there, it's incredibly successful. People who use drugs want to have care. They want to be treated well. They want to get their pap test and have their blood pressure managed. And so when you put these things together, you have great success. That's how I view this program as well, that this would be a great complement to addiction treatment and primary care as they work closely in parallel together.
Why would we allow people who are severely addicted and need the medication of heroin or of an opioid go into the streets and play Russian roulette with a supply that might kill them when we know perfectly well how to save them?
Vancouver Coastal Health Public Health conducted a chart review for those in Vancouver that died within 2017, and very interestingly, only 40% of those that were identified were daily opioid users, which mean that the other 60% of those people that are using opioids from time to time are living with alcohol addiction and stimulant addiction, using alcohol and stimulants primarily. So access to evidence-based treatment currently actually remains limited, and traditional opioid treatments like methadone are not indicated or effective for this group of people. So we need innovation to save these people's lives.
After 8 years of not having to use heroin, what happens to me if I go back out? Do I have a community that's going to keep me safe while I try to get back on track? Or do I have a community that deems me disposable and not deserving to my basic human right? I ask everyone today to look at how prohibition has played into this, how we can change it and support us on trying to change the way we hold space for people who use drugs, people who, for many of us, are trying to find our way out, and for many of us are not there yet. I beg for you to get behind this model and do something.